Hey there, everybody. Dr. Steve here with Kinesi, and this is part two of your Everything is Connected. Patellofemoral pain is connected to the rest of you. And we were talking about how the knee bone is connected to the hip bone, connected to the spine bone. And our approach is to help fix knee pain by addressing all the things connected to it. So, particularly the front of the leg, the anterior chain is something that adds a lot to compression on the knee and the kneecap into its little groove, creating more pain. So we started with some melting where we were doing some hip flexor and quad stretching, and then we went into the couch stretch position. So now what we want to do is we're going to take it into a little molding. We're going to go a little further, integrating this into a whole body movement. And what we're going to do is we're going to use the grid here, and we're going to use the wall behind me and have three targets. So it's going to be straight overhead, a little bit to the left or to my right, and a little bit to my left. And so what we're going to do is we're standing with the 1 foot forward, the 1 foot back. The back foot, the heel is all the way to the wall, and we're going to have the toes pointed forward first. Then the hands, we're going to come up overhead to the over one shoulder, so over my right shoulder, over center, and over the left shoulder. And so we're going to go with these three spots back and forth. And what we're doing is we're lengthening through all of these tissues on the front side of the body, and particularly through the hip and into the leg, that anterior chain down the front of the leg that the kneecap lives in and can sometimes become painful. So not only do we want to do this with the toes pointed in, but now what we're going to do is we're going to wind it up a little bit more, or we did the toes pointed forward, and now we're going to angle the toes in on each leg. And so this is actually going to wind up the hip flexor a little bit more. And so as we toe in, we're taking those muscles and we're just putting a little bit of a twist, a little rotation into them. That's going to wind them up and create just a little deeper stretch on this side. Good. We'll go one more here. Okay. And now we're going to toe out a little bit. So as we toe out, now what we're doing is we're exposing just a bit more of the inner part of the hip and the thigh into the groin. And then we're going to do those same three reaches over the left, over center, and over the right. Now, we started with having the back foot at the wall. As you're feeling more and more comfortable with this and you have a better range of motion and control, you can scoot out a little further from the wall so that it's a bigger reach that you have to go to get there and touch your target. So let's switch our feet. We're going to start with toes pointed forward. We're going to reach up, hitting our spots up overhead, to our right, center, left. Good. And as you're going through all of these, we're stretching everything out. Then let's angle toes in. And let's go ahead and just angle both feet toes in. That'll make it a little bit less confusing. But here we're doing our same three spots. And as we change the start position of the feet, angling toes in, toes straight, or toes out, as we change that start position, we're changing the joint angles and we're changing the emphasis on the muscle groups a little bit. And so it becomes a simple little variation that turns it into a whole new kind of stretch and exercise. And so here we're doing our same three spots. And you may notice that it's a little bit easier, a little bit harder to reach back with one foot forward compared to the other foot forward, or with the toes in compared to having the toes turned out. Totally normal to have some things feel a little bit easier, some things feel a little bit harder. And as we change the start positions, that's really what we're after, is changing the angles, changing the emphasis on the parts. So we get a more comprehensive, a more complete molding to our melt, mold, move sequence. So that was part two. So first we started with some patellofemoral pain, and we were stretching out the quads and the hip flexors. Then we went into this more integrated whole body dynamic motion where we're lengthening through the trunk. And as the trunk is tied into all of this tissue on the front, and we're reaching up overhead at different angles, we're creating all of that lengthening through the tissues. So be sure to stick around for part three of our melt, mold, move sequence, where we're going to take it and we're going to integrate things just a little bit further into a whole body movement. So remember, here at Kinesi, we are here for you to find that pain and that relief in your body, the freedom to express yourself and do the things that you love to do. So if you or anybody you know are struggling with some knee pain, come on into Kinesi and let us help. We come up with solutions for your pain. Okay, till next time. Bye. Bye-bye, everybody.